Welcome aboard Delta Flight 371. We are currently en route to New York. This is Emily Wilson, and I'll be your flight attendant today. You better buckle up, Dr. Morgan. This is a longer than usual safety demonstration because today we are talking about New York City. Since we'll be on this journey together, let's go ahead and meet the city. New York City is located in New York State. It is in the southern tip of New York, and it's on the New York Harbor. It roughly has a population size of 8.78 million, and this makes it one of the most populous cities in the United States. It has 5 boroughs: Manhattan, Brooklyn, Queens, the Bronx, and Staten Island. It faces a lot of public health challenges. It has substance usage, infectious disease transmission, as well as chronic health conditions, and we'll talk about some of this as we keep going. New York City has lots of identities. It is one of the largest cities in the United States, making it a dense urban metropolitan community. It has lots of economic drivers, and one of the main ones is finance and banking, and this is in the Wall Street district. Wall Street's profitability has a wide range of profit every single day. Some of its top hedge funds can make over $20 million in a single workday. But it also has healthcare, education, media, technology, tourism, and international trade play. It is home to some of the largest hospitals, which we'll get into in a second, and has a very large cultural makeup. New York City has dozens of unique neighborhoods with 59 designated community districts for its immersed cultural diversity. Some of those examples are like Chinatown, Little Caribbean, and Jackson Heights. New York is home of some of the largest hospitals and major health systems. First, we have NYC Health and Hospitals. It is 11 public hospitals under a government agency. Next, we have New York Presbyterian. It is one of the largest and most comprehensive nonprofit, non-sectarian hospitals in the United States with over 4,000 beds. Now we have Mount Sinai Health System, which is a massive academic medical network, and it has 8 hospitals and 400 clinics. We also have NYU Langone Health, which is an academic medical center that has been ranked #1 for quality care over the last 4 years. Northwell Health is New York State's largest private employer and healthcare employer with over 105,000 employees, 28 hospitals, and over 1,000 clinics. Finally, we have Memorial Sloan Kettering Center. It is one of the world's oldest and largest private cancer centers. New York City has a vast public health organization. First, we'll talk about New York City's Department of Health and Mental Hygiene. It is one of the world's oldest and largest public health agencies that was founded in 1805 in order to fight yellow fever. Next, we'll talk about the New York City Health and Hospitals. Yes, we did just talk about it as a major health system, but its public health organizations were able to make it the first level 1 trauma center, and it produced the first hemodialysis machine. Next, we'll talk about Public Health Solutions, and this is considered New York City's largest public health nonprofit. Now for the Fund for Public Health in New York City, it has raised $550 million to support more than 440 public health initiatives in New York City. Next is the New York Academy of Medicine. No, this is not a school like I thought. It is a historic organization. This drives a lot of equity, policy, and research for the community. Finally, we have the New York State Public Health Association. This has been honored with excellence in the climate leadership, and this was awarded from the American Public Health Association. When we think of New York, we always think of the large skyscrapers and the beautiful parks. So for the physical environment, the housing conditions vary depending on the neighborhood and the socioeconomic status. A lot of the residents live in high-density apartment buildings or public housing developments. Well, depending on which neighborhood you live in, you could also live in a modern luxury housing. This beautiful image to our left is of the Prism Tower. This is on Park Avenue South, and it's located in the Nomad District of Manhattan. This building is split into 2 sections. One side features condos that are able to be owned and then rented apartments. In order to navigate the hustle and bustle of New York City, one of the major transportations is the Metropolitan Transportation Authority. This operates the city's subway, buses, and commuter railway system. The city is also so large, so it's able to be walked around, and it allows public transportation. But I know it's going to be really hard to drive your car around, so congratulations, Dr. Morgan. As a present from the flight crew, here is your personal Metro card and a new set of sneakers for your surprise trip to the city. We knew you'd need it, so here you go. Attention flight companions, the flight crew will be making their way down the aisle in order to give you the first snack of the trip. While they do that, we're going to talk about the physical environment infrastructure. New York City has lots of parks and recreation. It has home of the largest urban parks like Central Park or Prospect Park, but the New York City Parks manages over 5,000 individual properties, including parks, playgrounds, and community gardens that cover more than 30,000 acres, which is roughly 14% of the city's land, and inside of that includes 1,700 parks. A thing we need to talk about is food access. Food for the community ranges from large supermarkets to farmers markets, as well as small neighborhood bodegas. But when we're talking about food, we have to talk about the food trucks. There are over 5,000 licensed mobile food vendors in the city, and that includes carts and trucks. But approximately 500 are specifically recognized as food trucks. Something not so fun about the physical environment is the air quality and the pollution. New York City's air quality is impacted by the heavy traffic, industrial activities, and the dense urban development. Compared to the other cities in New York State, New York City ranks second for the highest level of urban air pollution. New York City has a very large social environment. We already talked about some of it, but the community organizations have thousands of nonprofit and community-based organizations that all support residents, address housing, food insecurity, health services, and youth development. We've also already talked about churches and faith communities. There are over 2,000 official churches, at least 425 synagogues, 581 mosques, and 2 temples in the city. The image above is the image of Eldridge Street Synagogue, and that is in the Lower East Side. Now for education. There's a large vast of education to get in New York City. It has one of the largest public school systems in the U.S., and there's multiple higher educations available. The picture you're seeing here is an image of Washington Square Park, and that is a part of the New York University campus. Now, we've talked a lot about what makes New York City who she is. We've talked about her businesses, we've talked about her buildings, we've talked about her parks, but we need to talk about the most important thing that makes New York City who New York City is, and that are the people that walk the streets every single day, the New York residents. Out of the 8.48 million, 2.63 million are white, 2.42 million are Hispanic, 1.73 million are Black or African American, and 1.27 million are considered other. There's a large global diversity in New York City, and some of the most common origins are from the Dominican Republic, China, and Jamaica, while 36.1% of the population is considered foreign-born. For the residents of New York City, they have a vast range of income, but per capita, the average income is $52,504, with the median household income only $81,228. There is a good bit of poverty here in New York City. 18% of the poverty lives below the poverty line, and out of that 18%, 24% are children under 18, and 20% are seniors over 65. Now, with the 8 million people in New York City, only 4 million are employed, and the education levels differ. 42.6% or 2.5 million have a higher degree, 38% or 2.23 million only have a high school diploma, and 19.2% or 1.12 million have no high school diploma. Now let's talk about some of the social determinants of health. The current life expectancy for an average New Yorker is 83 years old. In infant mortality, for every 1,000 births, there's approximately 4.2 deaths, unfortunately. And on the birth rate side, per 1,000 residents, there's 11.9 births. A major cause of premature death is drug overdoses, cardiovascular death, diabetes, and suicide, unfortunately. Now, with 8 million residents, there's going to be a lot of chronic disease. 800,000 New Yorkers have diabetes, 60% are overweight or obese, 25.6% have hypertension, and 8.6% have multiple chronic conditions. New York City is known for a lot of the behavior that is attended in the city, but we'll keep it PG and we'll talk about the 11% of adults smoke cigarettes, 7.2% use electronic cigarettes, 15% of adults use tobacco, and 16.4% admit to using excessive alcohol. Since New York City has a wide range of healthcare, there's a lot of access to it. 92% of the residents are insured, while New York State has one of the lowest uninsured rates in the USA. 80% of the adults have a primary care provider, and 75% reported to have a routine checkup within this last year. New York City Health and Hospital operates a total of 11 public health hospitals, and so that's where most of the residents end up going. Barriers include costs, insurance gaps, language, and transportation in order for the residents to access this healthcare. To continue with the healthcare access, there's also a lot of healthcare education. New York City is a major healthcare hub with some of the most advanced hospital systems. We've already listed a large amount of the hospitals that are in New York City, and a lot of them provide specialized care like trauma services, cardiac care, cancer treatment, and surgical procedures. In order to get the healthcare, you need to be educated. So there's a few healthcare education places that I listed, like NYU Grossman School of Medicine, Hunter College School of Nursing, which does have a CRNA program, so go them, and the Columbia University of Doctor of Physical Therapy program. In New York City, there is around 60,000 physicians, which make it about one of the largest workforces in the United States, and 22% of the public health workforce are registered nurses. But not every single one of them works in the hospital. You have to think about the people who take care of the people on the New York streets. There's 4,500 emergency medical workers. Imagine driving one of the ambulances in the streets of New York. We have so little EMS workers, props to them. But outside of just physical healthcare, there's also the mental health counselors. There's 7,000 currently practicing in New York City. There's a lot of strengths in the community of New York City. There's a lot of outreach programs from numerous hospitals and nonprofit organizations that all include free healthcare screenings, vaccination clinics, and chronic disease management. There's also a lot of public health initiatives that are coordinated through the New York City Department of Health and Mental Hygiene. Those programs focus specifically on disease prevention, maternal and child health, as well as environmental health monitoring. We've talked a lot about the faith-based communities and the support systems that are there and all the culturally dominated neighborhoods. We've also listed all of the churches, the mosque houses, the synagogues, and the temples. But the image above is the Manhattan, New York Temple, and this is one of the 2 temples that is in the city. As we talk about community strengths, we have to talk about the community weaknesses. Since there's 8 million people that live in the city, chronic disease is one of the main burdens. It's one of the leading causes of death amongst the New Yorkers. There's about 30,000 deaths per year, unfortunately. Over 50% of the adults are overweight or obese, and 91,000 residents currently live with HIV that are diagnosed and undiagnosed within the New York City. Another major thing we have to talk about is poverty and food insecurity. A notable portion of the population does live below federal poverty line, and that contributes to the housing instability and food insecurity. That also leads to how people are going to be able to get their food. So there's limited access to fresh foods that are affordable, and some of them rely on the convenience stores or fast food options, unfortunately. Some more weaknesses for the community includes the housing inequality and the overcrowding. Yes, there's 8 million people, so a lot of the residents experience overcrowding within their living conditions. And this is also a struggle of the rising housing costs. If there's 8 million people and I can't live in a comfortable environment, why would I want to pay the rising prices? And a lot of the places that people live are in older buildings, and they have a lot of environmental hazards as well. Another major weakness is the mental health resources. Access to mental health services are limited because of the high demand, cost barriers, and provider shortages. Like I said, there's only 7,000 currently practicing in New York City. One of the major causes of public health concerns are depression, anxiety, and substance abuse disorders. There are some environmental health concerns as well. The health outcomes vary depending on which neighborhood the people live in. Income, education, housing quality, or access to healthcare are all impacted. Communities within the lower socioeconomic status often experience higher rates of these diseases. Attention flight companions, we'll be landing shortly, so please stow away your tray tables and look out your window at the beautiful Central Park. Thank you for joining us on Delta Flight 371. We've officially landed in New York. I hope everything that you learned in this safety demonstration helps you on your spontaneous trip. Here's a warm welcome from Taylor Swift. This is Emily Wilson, your flight attendant, signing off.